All right, so a few days ago, there was this article in the New York Post about a 37-year-old woman who was having a bad headache and went to urgent care, and everybody thought that she was having a migraine. And then ultimately, about 36 hours later, it turns out that she was actually having a brain bleed. And so in this video, I want to talk about thunderclap headaches and subarachnoid hemorrhage to raise awareness about this huge red flag so that people, including healthcare providers, don't discount it when it happens, because it can lead to death or permanent neurological damage. All right, so this woman's story essentially was that she was having a very severe headache. She had also some vision changes with it, some nausea, vomiting, neck stiffness. She went to urgent care. They thought that she was having a migraine and sent her back home. And then, obviously the symptoms were getting worse and worse. And then she went to the emergency room and ultimately received the therapy and the diagnostics that she should have received from the beginning. And ultimately she did well, but that's not always the case. And that could have gone in a very different way. So what is a thunderclap headache? Essentially, it's a headache that's very severe. Sometimes we call it worst headache of life. The important thing about it is that it's not gradual. It's very sudden in onset and reaches its maximum intensity in less than a minute. And so when somebody has a thunderclap headache, that's always a red flag. One of the important things to rule out is what we call a subarachnoid hemorrhage. So that's a brain bleed that is happening when you have rupture of an aneurysm. So if you have a brain aneurysm, basically that brain aneurysm can sometimes explode. And if it does, it leads to a brain bleed that's called a subarachnoid hemorrhage. And that can be accompanied by sensitivity to light, neck stiffness, other meningeal signs, almost resembling meningitis, because of the irritation that happens to the meninges during a subarachnoid bleed. When you go to the emergency room and you have a thunderclap headache, usually we would begin with a CT scan, a CAT scan of your head. And that's because CAT scan is actually very sensitive for blood, and it can be done quickly in an emergency setting. However, if the CT head is negative and we still have a very high suspicion for a subarachnoid bleed, we don't stop there. A lot of times we would either do an MRI or we would consider doing a lumbar puncture, a spinal tap, to look for breakdown products of blood, what we call xanthochromia. But that's only if the suspicion is very high. Now, other conditions that need to be ruled out as well with this kind of thunderclap headache are RCVS, reversible cerebral vasoconstriction syndrome, which is essentially a vasoconstriction of the vessels inside the brain. So these vessels that are feeding the brain, as you can see right here, if they suddenly vasoconstrict, then it can essentially also give you a thunderclap headache and sometimes even focal neurological deficits mimicking a stroke. But that would be on the differential for a subarachnoid hemorrhage. And there's a lot of different causes for it, including drugs, cocaine, things of that sort, that can definitely lead to that constriction. And it tends to be reversible, but obviously at the time you don't know that. So it has to be taken very seriously. And we diagnose it by getting vessel imaging. So a CT angiogram or MR angiogram, or sometimes even a conventional angiogram, would show that you have that narrowing inside the blood vessels in the brain. There's other causes too, but these are the two most important ones to keep in mind. And then ultimately when we find the cause, that's when we can treat it. So that will include reversing blood thinners if needed, making sure that the blood pressure is well controlled. And if there is indeed an aneurysm, and this was a subarachnoid hemorrhage, then the treatment will either be coiling the aneurysm by going through the groin and then inside the vessel, so an endovascular approach, or by clipping it. So that's a neurosurgical intervention where a craniotomy is done and then the aneurysm itself is clipped. Okay, I hope you learned something new in this video. Spread the word about subarachnoid hemorrhages and thunderclap headaches so that your friends and family members know what to do if they ever have a headache of this sort. And don't forget to like and subscribe to the channel.